My name is Dr. David Dunn of the Macquarie Street Centre for Implant and Aesthetic Dentistry here in Macquarie Street, Sydney, and I am the head dentist. I started in 2022. I've enjoyed the experience. This is probably the most important question you'll probably ask me. My analysis was that it is too difficult to try and educate, bring somebody on as an associate, and then you spend all that time and then hopefully they want to purchase the practice. That is a very small pond to fish in. The second one is selling to somebody with a year transition. Well, I didn't want to stop. I love dentistry. I still don't want to stop. That's why I'm still going. I'm not doing it for the money or whatever. I'm doing it because I'm passionate about what we're doing. I didn't want to then sell to somebody perhaps I didn't think had the skills or the personality or whatever, because we're very protective of our patients too and our staff. So that option, again, was a small pond to fish in and was concerning in that aspect. So then we look at corporates, and at the time when I was looking, the corporates didn't have a great reputation. And frankly, understandably, they would say all the nice things at the start, get you signed up, and then they would start restricting what labs you could use, what materials, and they start putting impositions on the practice and the owners. And anecdotally, there are many examples of people being very unhappy with signing up to certain corporates. So I was wanting to do a lot of due diligence, and I met with many people that were interested in purchasing my practice, and NDC was introduced to me. And right from the outset, they were very different. They were very happy to let me run the practice how I want. They've only been but a value add to us. They have not put any imposition on what I do, how I do it, staffing, laboratories, materials, anything you can name. It has been a win-win solution. The profession's small, and so we hear about what goes on, and the corporates frankly had a bad reputation. But NDC, as I said, was very different in their whole approach. The people that I met, and I met from top right down, and they all sang from the same song sheet, and it was a very comfortable partnership, and that's what attracted me. And right through from our initial discussions, the financial analysis, how we came up with the buyout figure and so forth, it has been a very easy and comfortable process. And I think that's fairly unique with NDC, because you talk around, I lecture around a lot, so I get to speak to a lot of dentists and going through transition times. And they ask me about NDC because equally they hold concerns, and NDC seems to be quite an outlier in how it looks after its dentists and partners with them. NDC has been outstanding, and I don't use that word lightly, outstanding in computer upgrades, software upgrades. We are using X-Guide, which is a navigated computer system. They've invested in that because that's a big part of my practice. Cone beam scanners, you name it. When we can produce the reasons and the validation of doing that, there's no problem. I think two areas. I think HR, especially in this day and age where contracts and regulations are impacting practices so much that they cross the T's and dot the I's in making sure all our contracts and policies and so forth are all absolutely as per regulation and A1. The second part would be we think we were pretty good in our management figures and analysis of our performance, but NDC has brought that to a new level in providing that information to us and And we're still managing it and using that information, but we've got that data broken up into so much detail that it's an important performance tool for the practice management. So they're probably the two biggest areas. It has been nice to be introduced and meet a lot of other practitioners in the NDC community, and many of those have now become referrers. So that's been a value add in that we have a broadened referral base, which was not the raison d'etre of what we did, but it's certainly been very nice. The first thing is you need to prepare your practice for sale. I would suggest you get an advisor in to help you look at your performance, your numbers, that the inefficiencies and so forth, work out, well, how long do I want to stay on? Is it going to be a short contract and I'm out of here? Or no, I'd just like to get some financial remuneration from the practice, but I'd like to keep going as long as I want, and I can still have the practice without some of the hassles of running a practice. And then the third is you've got to hunt around who's going to fulfil that need. So then you need to do your due diligence, and NDC would be on the top of your list. I went with NDC after a lot of due diligence, and I'm very comfortable, and if I was in the same situation today, knowing what I do know now, I'd be making the same decision.